Welcome, everyone, to this Adult Education Senior University session, Dementia Conversations, Driving Doctor Visits, Legal and Financial Planning. Today's presenter is Jon Miller. Jon, we are very glad to have you with us today.
Thank you very much for having me today. I am Jon Miller. I'm the program manager serving Northern Indiana as part of the Greater Indiana chapter of the Alzheimer's Association. In my role on the program side, I work with volunteers across the area in our communities, working to help bring Alzheimer's awareness to every individual in our communities through awareness presentations, community education opportunities, working with community partners and our support groups as well, and other information well beyond. And so information like today's program about dementia conversations, something that really just motivates me is being able to share these resources with everybody that comes into these. I know folks that are a part of these programs and attendance today. Thank you for being here. I know this can be such a difficult topic, and having these conversations, but they're so important. And I just wish my family had these when we had gone through things with my grandmother. Because my personal connection with the disease, I mean, growing up with her as far back as I can remember, she couldn't. And just forgetful a lot, generally grumpy, certainly, I mean, forgetful with a number of things, repetitive. So learned patience at a very young age with just how knowing that grandma doesn't remember just asking me this 10 minutes ago. That was common. I thought that aging, like that is how we age. And it's not. Dementia aging is not regular aging. And so we just never knew how bad it was for grandma until my grandfather had passed away. And that's when we really got to see everything. Where, I mean, she was leaving us voicemails, 24 a day. I remember coming home to and just paranoid, accusatory, just angry, crying, sobbing on the phone in these voicemails, not really remembering anything other than, that her husband wasn't there anymore. Grandpa was gone, didn't remember him passing and all that. And really, leaving, going down to church and getting stopped by neighbors and the priest. She only lived 5 or 6 blocks away. Thankfully, it wasn't too far, but I mean, even then, I mean, it could have been worse, right? But ultimately, what motivated us to getting her into some sort of assisted living was her leaving the stove on a couple times, and just knowing how awful it was. And so something I wish my family had at the time was the resources of the association. And I'm grateful every day to be able to bring these educational opportunities and programs out into our community and share resources of the association and talk about this education for caregivers and those that need it. And so the association is the #3 supporter of research and funding for Alzheimer's and dementia in the world. U.S. government, government of China, Alzheimer's Association. So we're a nationwide organization that operates research around the world and internationally. And there's certainly a lot of research and momentum behind the advancements going on right now. But today, this program of Dementia Conversations is designed to help you talk with your entire family, including the person with signs of dementia, about some challenging and often uncomfortable topics related to Alzheimer's and dementia. These discussions may not be easy to have for you or the person that's experiencing changes in functioning. There is a fear of hurting those we love, facing changes related to aging and dementia, and being forced to deal with difficult family dynamics. You may try to wait until the time is right to have these conversations, but in reality, that time rarely occurs. The sooner these discussions take place, the better. This way, the wishes of the person with dementia can be included as much as possible, and unexpected situations can be avoided in the future. The changing needs of the person often signal that it's time to talk. We have heard from many people who tell us that some of the most difficult conversations they had with their parent or family were about going to the doctor to get a diagnosis or medical care, deciding when it is necessary to stop driving, and making plans for managing finances and legal documents to make sure the person's wishes are carried out and the costs of future care are covered and taken care of. Keep in mind that as we talk about each of these conversations, we offer a variety of approaches. Not all of these will be appropriate for each person. The approach that will work best for you will involve your customizing to fit the needs and preferences of the person with the symptoms in your family. Today's program will share some tips for breaking the ice and having difficult conversations around some of the most common issues that arise when someone shows signs of Alzheimer's or dementia. We'll help you plan ahead and build a care team that works and communicates well to reduce some of the stress that can accompany a disease like Alzheimer's. Give you the opportunity to hear from people who are dealing with similar issues. These individuals will share how they have handled these challenging conversations and connect you with helpful resources to enhance quality of life for everyone involved. You may not think of yourself as a caregiver, but you may be noticing some changes or signs in the person you care about that are causing you concern. Often, we find ourselves avoiding or taking ourselves out of difficult conversations around these issues for several reasons. Sometimes our family members say they don't need our help. We assume that other family members who live closer are taking care of things, and we fear that we might take away the person's sense of independence. Or the family disagrees about whether or not there is a problem at all. The idea here, though, is do not wait for a crisis to occur before having these conversations. You can actually avoid a crisis by talking about the issues and taking action in advance. By talking early in the disease process, you'll be able to hear directly from the person with dementia about their wishes while they can still contribute and be a part of the planning process. Despite the difficulty of these conversations, they need to take place to ensure the person's safety and well-being. Successful conversations start with being prepared in advance. So develop a plan for how to finesse the conversation, how to introduce the topic in a way that will be gentle and minimize resistance. The use of finesse goes beyond honesty. It involves understanding how difficult this conversation can be and thinking about how best to gently position the discussion for a positive outcome. Also, consider what you will do regardless of how the person responds. For example, ask the person whether he or she would want to know if you have noticed any changes in functioning. In most cases, the person will say yes, thereby allowing you to begin the conversation. If he or she says no, that they would not want to know about what you've noticed, focus on the fears that accompany these changes and how important it is to talk about the changes openly. The actual conversation about the changes you have noticed may need to take place in a separate conversation. Take notes about the changes you see. Begin observing and take note and note those examples of behaviors that concern you. Take notes after you see something of concern so that you can accurately talk about what you've noticed. Write things down so you do not forget the important points you want to cover, and bring those notes with you when you have the conversation. Be prepared to talk about how your own feelings are at play. Use I statements and try to avoid any suggestion of blame or criticism of the person so that they are less likely to get defensive or angry. Be gentle in your discussion, keeping the person's feelings in mind. You want to avoid having the person with these changes feel ganged up on. It's not quite an intervention. It's not that kind of thing, but you are referring to your loved ones about some of the changes that you've witnessed and developing the plan, the right plan of action for that person. Practice in advance. Rehearsing talking about sensitive topics with other family members will help you feel more comfortable when you have the actual conversation with the person with symptoms. Consider possible solutions to offer during the conversation. Initiate the conversation at a place and time when the person is relaxed, well rested, and comfortable. Sit close to the person, use empathy, and speak from your heart about the concerns. Oops. There we go. When someone in your life exhibits changes in thinking or behavior, it is important to be aware that they could be signs of Alzheimer's or another type of dementia. There are changes that are typical of aging, such as taking a longer time to remember names or needing a reminder about how to use the remote control or a computer or a phone. But you may start to notice these issues that go beyond typical aging, like that the individual is getting lost in familiar places, withdrawing at social functions, asking the same questions repeatedly, or forgetting recent events. People with dementia typically first recognize signs that have to do with forgetting how to do things they used to do with ease, such as managing money or remembering appointments. Conversations can go more smoothly if reference is made to these changes rather than those that the person has not noticed in him or herself. So picking those like really kind of easy examples that they can't deny or ignore. Sometimes the person may be reluctant, fearful, or angry when you try to get them to seek help. This can be because of his or her feelings about the disease or because of the effects of the disease itself. It can also reflect his or her cultural traditions, beliefs, or stigma about the disease. But we have some tips and tools that can help you get the individual to the doctor. It can feel awkward to approach someone about the changes that you have noticed, but many times the person has already noticed these changes in him or herself and has some concern already. The person may be afraid, and denial is one of the most basic ways we all have to protect ourselves from feeling overwhelmed. But the changes might be due to something other than Alzheimer's, and acknowledging this can help the person agree to take action. Many common ones would be new medications and symptoms or side effects from those, or overlapping medications. If they've recently experienced trauma or a big loss or just change in their life that is just stress. Stress can be a huge factor too in some of those. But it's just important to acknowledge and help along the way. So we're going to hear from Donna about the importance of having this conversation.
I think you have to be honest. I think that's the important thing with it. To get a loved one to the doctor, I think you just need to be candid and honest of what are you trying to do. We're trying to understand what we're up against. It's just so important to do that, because you can't battle something that you don't know what you're battling. Again, it may not have been Alzheimer's, it could have been depression, it could have been so many other things. And guess what? There's other things you can do to take care of those issues as well. But that's what you need to be able to do. You can't ignore something, it's not going to go away.
So it's important to get the person to the doctor to see if the changes are due to Alzheimer's or something else altogether. There may be treatments available that can help the person, whether the diagnosis is Alzheimer's or something different, but the person can't receive treatment until they've seen a doctor. You can be honest with the person with symptoms about the fact that this medical determination needs to be made in order to receive the best care. Suggesting a doctor's visit can be all that is needed to help get the ball rolling. Other times, just being honest and direct isn't enough, and the person needs more support or direction. Here are some ideas that can help. Use words that are most comfortable for that person. Be aware that the person may be sensitive to particular words, such as Alzheimer's. For example, you can say, let's talk with the doctor about the fact that you're having trouble doing some of the things you used to do, rather than, we need to have you see a doctor to do an assessment for Alzheimer's disease. Let the person know that it's time for the annual wellness visit. An annual wellness visit, which has been offered at no charge by Medicare since January of 2011, is a visit for developing or updating a personalized prevention plan that can help prevent disease and disability. It includes an examination of the patient's cognitive and behavioral changes that may indicate a form of dementia like Alzheimer's disease. Many older adults have not heard of this benefit, but taking advantage of it can be a way to get the person to have their cognition evaluated. Pair going to the doctor's office with an enjoyable outing. You may want to suggest going to see the doctor and then doing something enjoyable together, like having lunch at a favorite spot. Invite family to communicate concerns and questions to the doctor too. Whether you are able to be there for the appointment or not, you can prepare a list of your concerns and questions and provide that information to the doctor before the appointment. Because of doctor-patient confidentiality and protections under HIPAA regulations, the doctor will not be able to speak with you about his or her patient without a signed release. If your family member agrees to it, it can be very helpful to get a signed release of information that would allow the doctor to communicate directly with you as the caregiver or one of the caregivers with the family. The release can be signed at the doctor's office. If still reluctant, try using a therapeutic fib. There may be times when the person with symptoms is extremely reluctant to see a doctor regardless of your attempts to use reason. People with Alzheimer's often experience a reduced ability to use good judgment and make good decisions. Sometimes this contributes to the person's reluctance to go to the doctor. In these situations, the person's safety and care comes first. You may need to utilize a technique called the therapeutic fib to get the person to visit the physician's office. To get someone to a doctor, some family members or friends tell the person that a doctor's visit is required by the insurance company or by the doctor in order to authorize prescription refills, renew a policy, etc. Invoking this outside authority can help the visit to seem less like a criticism of the person and their current level of functioning, so resistance is reduced. As we've heard from others, having a conversation about driving may be one of the first difficult conversations families need to have after diagnosis. You may notice signs that your family member's driving has changed, such as accidents or tickets for moving violations, or things that are more subtle, like new scrapes on the car or the garage. You may have even seen the person make mistakes while you were in the car. Even though many of us will need to stop driving at some point, people are often reluctant to consider the issue because they are afraid to relinquish their independence. Denial that anything is wrong can allow a dangerous situation to continue, but dealing with the issue early on can help ease the transition. And here's Chris to tell us about how this happened in his family.
There's no exact answer on this is when you stop driving. You could tell when coming up to an intersection, as an example, the ability to understand what's going on around you was starting to deteriorate a little bit. Being on the highway with cars on both sides becomes a little bit more difficult. And first and foremost, the safety of everybody in the car as well as other drivers on the road. You think about that and you want to make sure you're not putting anybody in danger. But then the difficult part is telling your dad, who you love, and you know he loves driving, and he's used to it, that he can no longer do that. But then even then, taking the keys away full time was very difficult. The doctor was very helpful in just saying, medically, you can't do this anymore. But my mother had the hardest time with this because she knew how much this was going to hurt him as well. And this is one of the first things that we had to deal with as a family when it came to telling my dad that he had to stop doing something because of this disease. That meant a lot to him.
So there's no single moment when the decision to stop driving should be made. You can incorporate the person's doctor or other professionals to let the person know that it's time to stop driving. Whether the changes in driving are due to Alzheimer's or not, here are some ideas that people have found helpful when discussing this sensitive topic. Plan ahead before an accident occurs. Before changes in the ability to drive are seen, talk about the fact that the person will need to stop driving at some point. Many families find it helpful to have an open discussion and develop an agreement about how the person would like you to recognize that it's time to stop driving, such as noticing more mistakes on the road or new scrapes on the car. When the time comes, the person may not remember the conversation, so it can be helpful to write notes about your agreement to use later, or even ask the person to sign a driving contract. Express your concern about specific changes you noticed. Let the person know that you care about and support him or her, and reinforce that as the reason for your concern. Use specific examples to show that these are real problems. Like, last week you did something really different. Here's what happened. That concerned me. Appeal to the person's sense of responsibility and concern for others. For example, you could say, I know that you wouldn't want an accident to happen and for you or someone else to get hurt. If you anticipate that the person may resist having the conversation about driving, there are ways to make it easier. Here's Sheila talking about how she approached it.
Some tips on having the conversation is pointing out, especially for my father, the potential danger to others that it may cause if he's behind the wheel. And just talking about it from the standpoint that this is not only the best thing for you, but this is also the best thing for others around you. And these are some of the alternatives, making sure that this is what's going to happen, having a plan. If mom can't take you, then Uncle Thomas or will be here to take you, and we will make sure that you're getting out of the house and that you're doing some things. So, presenting the bad news, but then also presenting the plan. And for my father, that's really, really important to have a plan.
So the safety of the person experiencing changes, as well as the safety of others on the road, is a key issue. It helps to have a plan in place that lets the person know that arrangements have been made to allow him or her to continue to go places, do things, and be involved with others. Removal of the keys doesn't mean, complete loss of independence, or being able to get around, but being able to prove and show and know that they're, still able to go and do things is reassuring for the individual. And I think for everybody. So establish a plan for alternate transportation in advance. So along these lines, be sure to include transportation to places that will help the person maintain social connections and hobbies, such as going to stores, appointments, bridge club, or church. When you talk with the person, provide reassurance that you want to help maintain their active lifestyle and that those needs have been included as a part of the plan. Incorporate the voice of an esteemed professional and have empathy. Ask a physician to write a letter or prescription stating that the person must not drive, just as Chris discussed in his video. Use empathy in your conversation and think about ways to foresee and minimize the person's sense of loss. Consider talking about this from the standpoint of retiring from driving rather than giving something up or something being taken away. Here's Wendy talking about a key component to making this conversation a successful one.
Talking to somebody about stopping driving, I think it's most important to understand that that is tied to someone's independence more than most things. And so by saying you can't do this anymore is like telling the person, it's like ripping away their independence. And that doesn't feel good for anybody. I know that I've always tried to put myself in that situation. What would I think if someone was saying this to me? You don't get to do this anymore. And how would I feel? And how would I want somebody to talk to me about this? And so if you try to I think sometimes too many people try to approach it as, very punitive. And I'm doing what's right for you. So why don't you understand, without really turning the tables and putting themselves in that position, understanding, how helpless that feels to take those things away. It's important to be thoughtful about what that experience is like for the individual.
Driving is tied to the person's independence, no doubt, and taking that away often feels like such a loss for an individual. I mean, when I think about this and kind of go through this program, I think about it myself and likely the conversations that I need to start having with my father and as he's getting up there in retirement. So it's just important to think about and to treat it gently. I mean, as if it was happening to you, right? Thinking about what the experience is like for the person and using that empathy in your conversation helps the conversation feel, like she said, less punitive to the person with the symptoms. It's important to respect the person's sense of independence while helping them understand that you're concerned and that these issues need to be discussed and addressed together. One of the ways that we all provide ourselves with choices that maintain our independence is by making legal and financial plans for our futures. Many families do this only to be taken by surprise when dementia enters the picture. As medical and long-term care costs in the US rise, families may need to step in and provide both care and help with the person's finances. We're going to hear from Chris again.
Financially, this disease will increase the cost of living. It's just a fact. So planning for those extra costs is that much more important than what you were planning for before. And so you have to review everything that's in place, see what changes need to be made, both legally and financially, and you have to monitor that going forward afterwards too.
Alzheimer's disease and other dementias increase people's cost of living. There's just no way around that. Changes in plans will need to be made and monitored on an ongoing basis. It is always good to review existing documents to make sure they are current, but once there is an Alzheimer's or dementia diagnosis, plans that were put in place years before may need to change. Care partners also needs updates for their forms, since the person with dementia may have been named as power of attorney prior to the diagnosis. Some people may have plans in place, but may still be uncomfortable discussing their financial status with you. You may also feel reluctant to do anything that may come across as intrusive. Talk about it. Making legal and financial plans early ensures that the person's preferences are included in the plans and that the family will not need to make rash decisions at the time. It is important to take the time to have these conversations. It can be scary, but very necessary. In this video, Julie tells us about how she talks with friends who ask her about having this kind of discussion with her mother.
Here's what I've come to after all of this. That it's the most loving and kind thing you can do for them is to be honest with them and say, this is like a really scary thing. And I feel a lot of discomfort bringing this up to you, but you know, I tell them, if you're going to be the one who's going to take them on this journey, then you have to tell them, I'm going to be here on this journey with you. And there are things that we have to do to get this in place. We're going to go on this journey together. I've told you I'm going to be here with you till the end. So let's get this ready. It's like we're going to go on an ocean ship. We've got to get things packed up. We've got to figure out what we're taking with us. We got to get ready. And the things that we have to get ready, we have to make sure that we know which doctors you're going to be using. I need to get this signed, okay? So that if you go in there and they have to do surgery, for example, I got to have this durable power of attorney for health care for you. I have to have this worked out, okay? Now, if for some reason, okay, you need to go to rehab after something, I have to have these documents here, the financial stuff, so I can get these things taken care of for you while this is going on. I don't want to have anything get in the way of us being able to progress and keep doing this. I said, it seems hard because it's hard in our heads. You know, everybody's read about people who've stolen from elderly people, who've done these horrible things. But if you're the person who's approaching this with loving kindness and compassion, and you're willing to take this person on this journey, you're not doing a bad thing. You're doing the right thing by talking to them about it. And you approach it from the standpoint of, I'm here for you. I'm doing this for you. We're going to do this together. And I'm going to help you through this. And these are the tools that I need to make sure that we can do this.
Don't you just feel ready to go talk about it? I think her words really help. Just to reiterate, talking about these sensitive issues is a kind of thing to do with someone with dementia. Our fears about how the conversation will be perceived may keep us from taking this important step. Approach the conversation from the standpoint of being with the person throughout the course of the disease and needing these documents in place to help them get the best care possible. Begin by explaining that you are in this together. These discussions may seem to go against some of our social norms and represents a shift in family roles. Understand that having this conversation will help you and the person with dementia make the plans you'll need to get the best care and will allow you to connect and enjoy your time together in the future. It can be tremendously reassuring to let the person know that you will be a part of the process now and in the future. This way, the person you love can feel that you are on the same team. Start by asking questions and gathering documents. Think of the conversation as a chance to ask questions rather than to tell the person something. What documents are in place now and where are they kept? Who has copies of the documents and who should have copies of the documents? Who should review these documents? Family, professionals, anybody else? Pull documents together and get the ones that need to be completed or altered. Explain that these are standard plans that need to be made as we get older. Reduce the resistance to the process by explaining that having these discussions and completing these documents are things we all do as we age. We all need to do as we age, I should say. Break the conversation into parts and try different times and locations. If you only have the conversation via phone, try in person. You can also write a letter to get the conversation started. Don't feel you have to cover everything in one sitting. It may help to do the planning in smaller segments. You can address the person's finances one day and then talk about legal documents another time. Involve others to help talk about finances. Ask a financial advisor to help with the conversation or involve a brother or a sister. Some families make decisions to pool resources to ensure that care can be provided and the expenses paid. It is important to understand that what the financial situation is so your family can help you make the best long-term care choices. Just as having these difficult conversations is challenging, caring for someone with Alzheimer's disease is also a challenge. But there are steps you can take to make things easier for everyone involved. As our veteran caregivers tell us, no one can do this alone. Everyone who provides care for the person is a part of a team, and care teams work best when there is good communication. The first step is to begin their conversation by talking with the other people on the care team. As with any team, your care team works best when there is an open flow of communication and when decisions are made together. You, the person with dementia, and your other family members are all at the center of the team. And whether family members live near the person you are concerned about or far away, everyone can participate. Families typically look at their primary care doctors to help with making medical plans. Other medical professionals who specialize in the area of dementia care may be included to make a diagnosis. Once a diagnosis is made, find out who will coordinate care on an ongoing basis. This is often the primary care physician. Your care team does not stop there. Peers can be a tremendous support to the core care team as the disease progresses and care needs increase. Friends can offer much needed breaks and emotional support. Everyone who is working and a member of the care team should contact their company's HR department for employee assistance program to ask about caregiving benefits. Families can look at their pool of resources and make decisions about how to proceed. There are community resources available where you work and live. Some are often or even online, so your entire family can have access to information and support. The Alzheimer's Association Alzheimer Navigator is a tool that allows your family to create a personalized action plan to connect you to a local resource, other information, and support. And you can visit alz.org/Alzheimer's Navigator to access that. This is just one of many resources that the Alzheimer's Association provides for people going through one of the most difficult periods of their lives. On the resource list that you're reviewing here, you'll see that the programs and services of the association. Take time to explore our website and check into the resources that are available through your local chapter office. With the Indiana chapter, I would be a great contact, as well as my counterpart that serves the central and southern parts of Indiana. Begin a conversation with your family by sharing these free Alzheimer's Association resources. And just kind of going through here, the Alzheimer's Navigator, the Community Resource Finder. The Community Resource Finder is one resource, how to find programs like this one nearest you, whether it's an education program, an Alzheimer's Association awareness presentation. Typically those are held at other meetings. Or support groups. We have a number of support groups that meet across the state, northern Indiana, as well as online. That is how you can find what's nearest you. The Community Resource Finder, it's a partnered website with AARP. Punch in your zip code and it'll spit back everything within X amount of miles. I think it's 25 miles is the default for events that are happening. The Alzheimer's and Dementia Caregiver Center, the Safety Center. Another big one is our helpline. Number one, I think the first big thing that I learned as I was even going through my interview process for this position was that there is a 24/7 800 helpline available for any and everybody. It's free to access, 200 plus different languages. I don't know how they quite do that through interpreters, but it's there. Master's level clinicians are available, whether you have some concerns that you've noticed maybe in yourself or a loved one or a neighbor, something's been bothering you, you can't sleep at 2 or 3 a.m., you can give them a call. And if you're in a care crisis kind of situation, you need to know, I'm at a hospital, I'm looking for behavioral care or long assisted living or memory care, they can call the number and you can talk to somebody that will help through your specific situation. There are social workers available for calls to be raised up to. They know what's up. I am a nonprofit professional. Our volunteers are volunteers. We're not the ones to give a care crisis call to. Please call the helpline 800-272-3900. Other ways to find us and our information and training, I'll highlight our training. So this program, along with 12 or 15 others, are all available online to click through at your own pace, or you can take all of them or just a couple of them if you're looking for specific other education kind of information. Those are all available at training.alz.org. I think you just have to create a quick profile and you'll have access to our full course library catalog. Remember that no one can provide all of this care alone, and the sooner in the disease process that you have these conversations, the more smoothly the team can function to provide assistance. Helping the person you're connected or concerned about begins with talking about having these difficult conversations. On this slide, again, you can see our website and our toll-free 24/7, 365 helpline. You can call or contact us anytime. We are here to help you, your family, and anyone you know who is affected by Alzheimer's or dementia. And that kind of wraps it up.
Thank you, Jon, for teaching us how to have those difficult dementia conversations. Now is the time for Q&A. We also have a question in chat. The question is, what are the symptoms of a late stage dementia?
Good question. So in one of our other programs that is available as one of those online programs is the 10 warning signs of Alzheimer's, as well as there's another one called Understanding Alzheimer's and Dementia. Between both of those, it gives you a really clear picture as far as what to look out for versus, dementia aging versus regular aging. And kind of more of what's happening with the disease and in the brain, and the like working when dealing with the disease itself. And one of those highlights is about the early, middle, and late stages. Now, all symptoms affect everybody differently. The 10 warning signs, not everybody has to have all 10 in order for there to be a concern. It can just be one thing, it could be a couple things. And they can happen in varying degrees. It's not like all or nothing, or like that. In the earlier stages, it's a lot of the warning signs, the forgetfulness, the withdrawal, kind of pulling themselves out of what they normally used to do, problems with driving, and even walking, or let's say they had a cane or a wheelchair, and their spatial relationships and how they perceive the world around them changes because of the changes in the brain. So it's not just driving, but getting around at all. Typically through the earlier stages, people are still taking care of themselves, still, good hygiene, just kind of needs that extra kind of help. But what we see to the middle and later stages is once folks really kind of stop just kind of taking care of themselves, a lot more trouble with words and getting around. That's kind of typically when we see folks getting into like assisted living, memory care units, and nursing homes as the disease progresses. So in the middle and late, there's a lot less. They're speaking less, they're communicating less, they're able to communicate less. Their loss of words, not being able to describe or use the right words with things. And ultimately, towards the end, in the later stages, their difficulty doing everything and ultimately swallowing towards the very end, and they just can't take care of themselves. And that happens differently for everybody. There's no I got a diagnosis and you're going to be, in the early stages for X amount of years, and then it's going to decline from there. It's not exactly like that. It's different for everybody. Some people hang out in the earlier stages, and it's a slower progression, and it seems like years. I think that's where my grandmother was on this plateau for a long time, and then it really, like I said, we didn't know how bad it was until her keeper passed away, and then it just blew up from there, and we knew again how bad it was. But it varying degrees for everybody. Everyone's situation is different, so I hope that helps.
Again, thank you for teaching us and informing us on how to have these difficult dementia conversations. Thank you everyone for joining us as well. Thank you all.
Thank you.